The international guidelines on human rights and drug policy are being implemented in Mexico as a document that every single agency that has relevant work on drug policy has to observe. Basically, after we organized a regional implementation dialogue here in Mexico City in January 2020, the Ministry of Foreign Affairs of Mexico sent the guidelines to all relevant agencies within the federal government. The response was very good. Basically, the drugs office of the federal government here in Mexico said that they were going to make an effort to try to implement them. And then the National Institute for Women also sent some comments in regards to the content of the guidelines and said that they were going to use them to try and guide their work on drug policy in particular. Civil society groups have also been using the guidelines to advance the introduction of an effective human rights perspective into drug policy efforts.
In Colombia, the international guidelines on human rights and drug policy have been used by courts and by civil society organizations. By courts, there are at least two important rulings. The first is one by the Constitutional Court related to a ban on consumption of psychoactive substances in public spaces. The court found that this absolute prohibition was unconstitutional and cited several times the guidelines as a supportive argument to its findings. In another very important decision, the Conseil d'État say that the police and the prosecutors should take into account the guidelines for their activity. It was a ruling related to an anti-narcotic operation by the police and the prosecutors in the territory of an indigenous people. The Committee on Economic, Social and Cultural Rights in the last years have made several recommendations to several states concerning the duty of states to adopt a human rights approach for tackling drug abuse. In one of its last meetings, the committee used the international guidelines of human rights and drug policy to support this recommendation. It made it in the concluding observation to the state of Benin.
The guidelines are very useful in my jurisdiction. I have sent the guides to the Minister of Security, and then I sent to the place I work, is the National Secretary about drug policy. So the bosses of these places take note about the guidelines. I have a good response about that, the contents of the guidelines, because the declarations of this Minister of Security, the declarations of the Minister of Health, and some declarations too in the biggest province that we have here in Argentina, that is Buenos Aires, that some high-level officers take note about the guidelines and take note about the necessary approaches about harm reduction, about decriminalize people who use drugs.
The meeting in Mexico was really interesting to be sitting next to government officials from human rights, but also with, law and order or healthcare, or with civil society organizations, definitely. For me, as a drug user and being part of the discussion was really interesting because people was really open to listen from what I say when I usually get discriminated in many other places talking as a drug user. So these spaces definitely helped us to speak more openly and people to listen more openly.
The international guidelines on human rights and drug policy has been an important reference to the development of national guidelines on social protection for pretrial detention in the country. The national guidelines for social protection will be an important tool for these psychosocial teams that will be working in pretrial detention hearings. The international guidelines on human rights and drug policy has been one important reference for the development of our national guidelines in Brazil.
The meeting that we had, the regional dialogue that we had here in Mexico in January 2020 actually brought together a very nice community of scholars, representatives from civil society organizations from across the region, and also institutions from different governments in countries like Colombia, Mexico, and Uruguay. The conclusions of that dialogue is that not only do we need to enhance the human rights perspective when it comes to drug policy, but also that we actually need to start measuring and evaluating. And there was sort of a momentum for a generalized call for decriminalization of drug use and drug possession.
At UNDP, we're pleased that the Regional Implementation Dialogue for the International Guidelines on Human Rights and Drug Policy in Latin America was a success. We already see the guidelines being used in the region with the UN System Common Position on Drug Policy, and with the help of tools such as the guidelines, we can support member states develop and implement coherent, evidence and human rights-based, development-oriented and sustainable responses to the world drug problem within the framework of the 2030 Agenda. We can engage communities, for instance, of people who use drugs and crop growers, in order to leave no one behind.
The guidelines is a document. Its publication is actually not the end point, it's the starting point. And what's important for this document is to make sure that it has life and that it lives beyond a bookshelf, beyond a boardroom, and actually can contribute to the meaningful change that we need to see on the ground around the world today. So it's really fantastic that we've been able to create these informal regional dialogues that sort of they create a space for a range of actors, from government officials in law enforcement, health, social development, UN entities across the various different technical support agencies, academia, and civil society to sit together and think about how to foreground human rights in the context of their national reform processes, various different types of criminal justice reform processes. We look forward to co-hosting with our colleagues at the United Nations Development Program, the German government, the Swiss government, the Office of the High Commissioner for Human Rights, and a range of other civil society actors.